say, write down everything, and you'll be protected. In my view, while it is important to write good, legible, and adequate notes, it may not necessarily be a defense. Once a medical expert put this, at a meeting of the Medical Legal Society of London, write a lot of notes and they'll hang you with them. For various reasons. One is that sometimes you engage in defensive writing. You forgot to write down something, but you wrote a lot of other things, say. Or it appears very defensive. And in some instances, that you go on the belief that if something is written down, the judge will swallow it because it's true. Because if it is written down, it must be true. That is not the law. Many a time a judge has said what was written there is not true. So, when it comes to consent, by the way, we have got a law here now, that consent must be in writing. When the reality for many years it has been, you can even take oral consent. We have oral examinations, oral interviews, oral sex. Why not oral consent? Look at our penal code, consent to sexual intercourse. Does it say it must be in writing? But if you get some character nowadays, to review the penal code and come up with the new version and say it must be in writing. So that is not the law. But now we have got some legislation for private hospitals, consent must be given in writing. But in an emergency, go ahead and do what is necessary, etc. But please, there is no magic, if I may say, in written records. More important is good clinical practice, a sound approach to the patient, knowing medicine, being caring and compassionate. All these things matter.
Thank you.
Thank you, Mr. Chairman. My name is Pakma. I think we've heard a panel of very interesting, well-experienced speakers representing the medical, legal, and academic fields. For a change, how about hearing from a patient? I've been a patient, in a sense.
Let me give a bit of background. I went with an accident when I was a student at this university some 35 years ago. And I've been in and out of the hospital after that for treatment for pressure sore, and as well as one surgery which I avoided. I was suggested by the doctor to do a surgery which I chose not to do. And I would like to share this with all of you. I think one important area that has not been mentioned is the patient. I mean, you've been talking about the medical aspect and the legal aspect, and the subject here is the patient. Nobody listens to the patient. The patient also has an interest because whatever is done, whatever surgery or whatever treatment is done, is on the patient. So I think in a doctor-patient relationship, there should be a two-way communication where, I mean, of course, you don't expect the patient to have knowledge that the doctor has. But on the other hand, the doctor must also listen to what responses the patient gives. Let me share with all of you an experience that I went through, and I hope what I'm going to share does not border upon excessive disclosure of information. But I think I'm prepared to say it because I think it will be of interest to both legal as well as medical students. When I was in hospital last for treatment for my bed sore in the year 2000, it was discovered that, while I was undergoing treatment for the bed sore, the rehab doctor came and asked me whether I had done my urodynamics for my kidneys. And I said I had not done. So she sent me for, urodynamics. And this is a test to show you the condition of the kidneys. And the way I'm a paraplegic for information. I injured my spinal cord at T12, and I've been paralyzed for 35 years now. And then in the year 2000, about 23 years after my accident, and the way I empty my bladder was manual compression. When the bladder gets full, I do a manual compression. And that was what I was taught way back in 1975. And that causes, when you press on a full bladder, it causes backflow. And the urine goes back into the ureter and, it fills up the kidney. And the cortex, this is my basic knowledge. I'm not a science student, but, knowledge that I gained from doing health science before. And the cortex had thinned. And the urodynamics result was quite bad. It showed that the cortex had thinned. And the doctor told me that if I don't go for a bladder enhancement, or if I were to leave it like that, the kidneys will fail, and I'll have to undergo dialysis when the kidneys don't function. So what she suggested was I do a bladder enhancement, and I was called together with a few other patients, and we were given information on what this bladder enhancement involves. And I was told that part of the gut, the large intestine, would be cut, and that the material, that gut would be used to patch. They open the bladder and they patch it to make the bladder bigger so that it can contain more urine. And this is to reduce the hydronephrosis, which causes the thinning of the kidney walls. So I was wondering, I had questions to ask the doctor even. The gut, the bladder, as far as I know, is a muscular bag, right, doctor? And the gut, well, the intestines have got some lining and they've got some mucus that is secreted. So I had a question in my mind: if you take such a material, and patch it onto this bladder, won't the mucus, won't it continue secreting, and won't there be any complications? So she said, in the long run, there is a possibility of, it becoming cancerous, or you developing cancer. So that, frightened me. So I said, okay, what other alternative, besides going through surgery, what other things can I do to help reduce this, pressure and thing building up in the kidney, the hydronephrosis. So that is when she suggested that I try another method of emptying my bladder. One more thing. She said, after the bladder enhancement, I had to empty my bladder using a tube, a stoma, a hole would be poked in my abdomen, and I had to use a tube to empty my bladder. So that too worried me, because naturally you empty your bladder according to the gravitation, downwards. So if you were to put a tube and empty, and I gave an example, if I were to put a hose and empty water from a pail, not all the water will come out, so there will be retention. So, these are the questions which I asked. And then only she said that, okay, maybe we can try another method, which is clean intermittent catheterization. So that involves me inserting a catheter into my bladder and emptying every 4 or 5 hours as it builds up. So, and when I opted for that, I'm glad that I opted for that. So when I tried this method, after 6 months, I went for check again, and at the X-ray department, when they doing the ultrasound, I asked the doctor quickly, what is the size of the cortex? She said, it looks normal to me. So then I thought to myself, well, the decision that I made, luckily that I asked all these questions, to the doctor. If I had not asked, and if the doctor had not listened to me, taken my views and opinions into consideration, I would have ended up having a bladder enhancement, and maybe I wouldn't have this added number of years, that I've survived. So these are the things which I think we have to also look into. The patient, there are many patients who are well informed, and before a consent is made, I think the doctor has a duty to inform as much as possible. I think there is no harm and no worry about too much information being told to patients, because people are, I think, becoming aware of their, not only of their, the